Okay, here you see the normal curve in a patient's neck or a person's neck, and the person obviously is facing that way. Should have a reverse C shape, and what we're seeing a lot now is with people sitting in front of computers for prolonged periods, or they're working with their head down, the curve will reverse or straighten. This puts pressure on the muscles in the back of the neck, and when the muscles are contracting for a short period of time, for any length of time, chronically, it will cause lactic acid to build up in the muscle tissue. And that lactic acid, the byproduct of that is muscle pain. So a lot of times people will come in and they think they have a muscle problem, and really their structure is out of alignment in their neck, and that's causing the muscle pain. So there's kind of 3 sources or 4 sources of pain that you can have in the neck. Muscle pain, you can have joint pain, you can have nerve pain, and you can also have disc pain. And we find out which one of those is causing the pain, fix the problem the best we can, and then the symptoms will heal themselves. So in this particular chart, we're going over x-rays, what this looks like on x-ray. In this view right here, this is considered textbook normal. We have a nice C shape of the spine. You have nice good disc space in between. This is where the spinal cord and spinal canal is right there. It's nice and clean, it's nice and open. In this view, this is what we consider forward head posture. There's no degeneration in this person at this time, but the curve is reversed. It narrows the canal, and the disc space in this particular case is totally normal. But if it's left like this for 12 to 15 years, over time the spine will degenerate and you'll develop osteoarthritis, usually at C5, C6. You can see the narrowing of the joint space right there. This space is pretty good, but we're starting to get bone spurs right here and right here. This is very common, and it's totally preventable. If you get treatment at this phase, in phase 1, we can get you back to textbook normal. If you're in this phase, we can still restore the curve, stop this process from continuing, alleviate a lot of your pain, and restore the curve so that these other discs don't become involved and become degenerative as well. This is a form of degenerative osteoarthritis. It's not due to genetics, it's due to biomechanical stress over a very long period of time. And then finally, phase 3, this is where the body is literally trying to fuse itself together because there's so much stress on that joint, those joints, that the body is trying to stabilize itself and fuses the joints together. This is when you get bone on bone, and at this point it's pain management or possible surgery to take pain away from a patient that is in this condition. So I get patients that come in all 3 different levels, and our goal is to try and get them back to textbook normal, and this is done through x-ray. Thank you.